Good afternoon. This is my case of English clinical practice about patient with type 2 diabetes mellitus.
3.
University of the Valley of Mexico of Faculty of Health Science Medical Career.
3.
Type diabetes mellitus in relation to metformin, the structure of the case report. My teacher is Alexis Uriel Castillo Hernandez. Student I am Francisco Josué López. Course 8. Course take English clinical practice. Studying it in Tabasco, Mexico, every week.
3.
Table of content. Summary. 3. Introduction. 3. Methodology. 4. Patient description. 4. Case history. 4. Physical examination results. 5. Result of pathology on other tests. 6. Investigation treatment plan. 6. Expect outcome of the treatment plan. 7. Real result. 8. Discussion. 8. Conclusion. 9. References. 10. Summary. Conceptually, it is defined as heterogeneous syndrome caused by genetic environment interaction and characterized by chronic hyperactivity as a consequence of the deficiency in the secretion or action of insulin, which triggers acute complications, ketoacidosis, and hyperosmolar, chronic microvascular retinopathies, and neuropathies, and macrovascular coronal heart disease, cerebral vascular and peripheral vascular disease. Introduction. Diabetes is a chronic disease in which the body use of sugar is altered due to partial or total loss of the hormone insulin or because it does not fulfill its function. It is characterized by varying degrees of insulin resistance, disorders of insulin, increased glucose production. Insulin allows carbohydrates to enter cells and be used as an energy reserve. If there is a malfunction, sugar accumulates in the blood, resulting in hyperglycemic sugar levels above normal blood glucose. It is a metabolic syndrome consisting of hyperactivity, glucose, polyphagy, polydictia, polyuria, and alteration in the consequence of absolute or relative definition in the action of insulin. Absolute and relative in the action of insulin. Type 2 diabetes mellitus is considered one of the chronic diseases with the greatest impact on the quality of life of the world population and constitutes a real health problem. It belongs to the group of diseases that cause Physical disability due to this variation multi-organ complication with an undoubted increase of circumstances of the countries. The patient, Sebastian Ferrell, is a 41-year-old married man from Tabasco, Mexico, who is committed to the car industry as a race driver and follows the Catholic faith. Attends an hospital follow-up to appointment, does not reveal allergies.
3,
Methodology. Type 2 diabetes mellitus affects 6.4 million people in the world who have been diagnosed with this disorder. In Mexico City, of the capital of Mexico, there is a high number of these related to diabetes, with 104 cases for 100,000 people. Patient description: Sebastian Viveros, 41-year-old married man from the state of Tabasco, Mexico, who's dedicated to the automotive industry as a racing driver of Catholic religion. Attend in hospital, follow up to consultation with a 172 centimeters height with 108 kilograms, a body mass index 39.9 kilograms meter square. Does not refer allergies with blood type of positive. Case history: 49-year-old man with obesity, controlled hypertension, go to the consultation for general fatigue with poor general condition. In addition to having polyuria, polydipsia, polyphagia for more than 3 months, I have also. The patient reports a weight loss and mentioned that he comes from an obese family with a history of both type 2 diabetes, so he goes to the neural health center. This is a physical examination results. Vital sign, blood pressure, respiratory rate, weight. Results of pathological and another test. Diagnostic criteria. The patient present these laboratory studies. Hemoglobin test A1C or ABA1C is a simple blood test that measures the average of blood sugar level from the last 3 months. ABA1C 7. Fasting plus glucose GPA 130 milligrams DL.
3,
Diagnostic criteria. 1. Glucose tolerance curve CTG at 2H 200 milligrams DL and another, and this is the rest. 2, 3, 4, the rest. This is the investigation treatment plan. no drug trend. It will be managed with a day not greater than 1,000 calories per day. Physical activity 30 minutes of day 5 days or a week. This is the pharmacotherapy, and this is metformin a metformin 15 milligram. We will start with an initial dose of 815 milligram before going to bed. The expected outcome of the treatment plan. Expected result pharmacological treatment. The expected normal glucose range is capillary preprandial glucose 70 to 130 milligram DL. Capillary peak postprandial glucose less than 180 milligram DL. Liquid hemoglobin less than 6.5%. Real result: laboratory range capillary preprandial glucose of 98 milligram DL. Capillary peak postprandial glucose of 107 milligram DL. 6% placated hemoglobin. In the discussion, there are advantages and disadvantages that various authors mention according to the use of metformin either in older and younger patients. In this case, the author of this article mentioned that metformin constitutes the basis of the treatment of type 2 diabetes mellitus in any group of patient age, including elderly patients. And this is the reference quote. Conclusion. Based on the case of the patient, all the information collected to the three factors which were very important were the overweight, the state of the patient, and the poor diet he had. Since the patient did not have any case of what was collected indicated on the organ and correct diet, the patient was in the stage and obesity too, and according to the information collected for the age and the weight the patient he had, the body mass index was known as correct parameters based and everything report. The patient was ordered to follow a strict diet to improve in state and live, and mainly for his health. These are the references that we use based on an article mentioned. In this clinical case, of course, these references are in all the staff. Ahora sí ya, puedes